Another dynamic that has been an area of great anxiety for individuals, particularly employers and people who work in healthcare and are essential workers. How do we make sure that all of our operations are running? And what happens is because there are so many positive cases don't necessarily mean that you are too sick to be and you require hospitalization. We just have to, again, manage. This is not Delta. This is not the first variant. This is Omicron, which thus far, and again, I have to qualify this, thus far has demonstrated, as we've watched around the globe and other places where it hit first, that it's not as severe in its impact. And therefore, we want to make sure that our critical workforce, who we've relied on from the beginning, and my heart goes out to them filled with gratitude, that our workers can get back, and that includes our health care, elder care, home health care, sanitation, grocery stores, pharmacies, restaurants. You know who you are. You know you're the ones that got us through the first many months of anxiety. We need you again. We need you to be able to go to work. So today, I'm issuing new guidance on returning to work for our critical workforce after they've tested positive, and employers may allow healthcare workers and other critical workforce members who've had COVID to return after 5 days if they are fully vaccinated, again, fully vaccinated, and are asymptomatic, or their symptoms have been resolving and they have no fever for the last 72 hours, and they don't have to be taking medication. So in this select group, and we also say that when they come back to work, they have to wear a mask. So we've working closely and seeing what the CDC guidance is. We waited for this to make sure that the longer period, the 10 days that was required when we didn't have as much information, and we also had a different variant, and now this is the predominant variant. Different circumstances. Again, we're always trying to adapt to changing data as we receive it and process it. So this is a new announcement from the CDC. We immediately wanted to translate that into the New York State workforce and people all over the state, mainly focused on making sure that we can get people back to work. So these critical services that New Yorkers need, healthcare, transportation, grocery stores, all the things that we've identified are as important, that they can get back to work as soon as it is safe to do so. Again, vaccinated, wearing a mask, asymptomatic, and that is being released shortly after I conclude this presentation.